Heart disease is the #1 killer for residents in Louisiana. However, the statistics for South Louisiana are getting better thanks to cardiologists and cardiovascular surgeons at Terrebonne General Medical Center. Through their efforts, this dedicated group of healthcare professionals, TGMC is on the forefront of advanced cardiac care. Please join us as we discuss the details and technologies of cardiovascular surgery, an advanced method of treating heart disease. Joining us this evening is Dr. Edgar Feinberg II, a cardiovascular surgeon at Terrebonne General Medical Center.
All right. We're really extremely grateful to have you here, Doctor. We appreciate that. We have an interesting topic, but first off, I just want to welcome you to the program.
Well, thank you very much. I appreciate being here.
Okay, good. And of course, you actually work at, with Terrebonne General Medical Center. It's the cardiovascular clinic of Homa, I think, that you're actually in charge of.
Yeah, that's my practice and company, yes.
Okay, good. And of course, we're talking about cardiovascular surgery. And let me just go through a list of things that I have here. First off, we hear oftentimes cardiovascular disease, but oftentimes it's taken for granted that everybody knows what that is. What actually is cardiovascular disease?
Well, most commonly, cardiovascular disease refers to the blockages that occur in the arteries to the heart. Usually from atherosclerosis, that is the most common cause of heart disease in America. And really when we talk about cardiovascular disease, it's a spectrum of diseases of the heart and the blood vessels, where blockages occur anywhere in the body, but the ones you know about and know about quickly are those that occur in your heart because the symptoms are so dramatic and the results of those symptoms are so dramatic.
Sure. And I guess cardiovascular surgery, how would that fall in line with what you just explained?
Well, as a cardiovascular surgeon, what we do is we use the methods available to us in the operating room to manage diseases of the heart and the great blood vessels of the body to free them of most commonly obstructions, but a variety of other issues that can arise related as far ranging as trauma, automobile accidents, to birth defects and things like that can affect the heart or the arteries.
What type of, because I understand you perform your surgeries at Terrebonne General Medical Center, what type of cardiac surgeries, I guess, are actually performed there at the hospital?
Well, the most common surgery that we do at Terrebonne General is going to be heart surgery for blockages, coronary artery bypass grafting. It's a very common procedure done in America. I think probably everybody knows somebody who's had open heart surgery, as
Sure.
they call it. That's how it's referred to relieve the obstructions of blockages in the arteries. People also have stents and balloons, and that's done at Terrebonne General as well. But when you look at the total number of cases, for about every 100 stents that are done, there are usually about 5 to 10 open heart surgeries that are done. And the reason is the blockages can be so severe that the stents or balloons aren't adequate to fix the problem.
Okay, so again, the common type of heart surgery is what?
It's a bypass graft.
Okay, yeah, and that's the one obviously a lot of people have heard about. Let me ask you, what are some of the other reasons that doctors might perform heart surgeries?
Well, you can have problems with your valves, and those problems can develop as a result of poor muscle function. The muscle begins to suffer as a result of poor blood flow from the blockages, and then the valves themselves fail, and then the heart begins to fail. So those need to be corrected, and that's most commonly done by open heart surgery. That is, you go to the operating room, you're put to sleep, they make an incision in your chest, going from about at the breastbone all the way down. It's something we've probably all heard of. And we actually stop the heart and open up the heart and change the valves, work inside the heart. You're on a heart-lung pump, and when everything is done, we restart the heart and take you off the pump. And that's the most dramatic surgery that we do. And I think it's really a miracle of modern medicine that we can do that.
Sure. Obviously, you hear more and more every day about people who've undergone some type of procedure or surgery, and then relatively soon, the recovery time, they're kind of back on their feet. But let me just ask you. So, we've talked a little bit about the types of the surgeries. And you mentioned about a bypass. How are other surgeries performed? Or are they all, where you open up the chest?
Well, I think it's interesting you bring that up about time back to work or back to your normal activity. And in modern times and modern techniques that we're using here at Terrebonne General allow us to do the surgeries and get patients back sooner by using smaller incisions, as well as by doing the surgery without going on the heart-lung machine, by actually operating on the beating heart. And these techniques, which aren't applicable to everyone, but certainly the technologies and techniques are developing so that we can do them for more and more people, or allowing people to be back into their lives sooner. And we've sent people home from surgery as soon as 3 days after having a major heart surgery. Because they're ready to go home, and they want to go home, and people very often feel better if they're home. They don't need to be in the hospital if there's nothing for them to do there.
Sure. And looking at my notes, I know you wanted to talk about the newer methods. You kind of touched upon that just then. But with the advance, what are some of the new things, I guess, that are out there?
Well, I think the newest thing relates to some of the techniques we're doing in combination with balloons and stents in the cath lab and in the heart surgery, what's called hybrid surgery. It's something done in between open heart surgery and balloons and stents. And I have a lot of collaboration with my colleagues at Cardiovascular Institute of the South.
Sure.
And we're working very closely, very arm in arm, on a lot of new techniques and technologies, and we have the support of Terrebonne General and the community. And as a result, the people in Terrebonne Parish are really getting some of the latest cutting-edge devices and procedures being done.
It's great for the community, Doctor. Let's do this. We need to take a break, and when we come back, we're going to continue our discussion with Dr. Feinberg. Don't go away.
No matter their healthcare needs, from OB to emergency room visits, rehabilitation, and everything in between. More people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
I'm Dale Bourgeois. I was treated for prostate cancer by Mary Bird Perkins Cancer Center at TGMC. My family doctor said that's where he would go if he had cancer. I'm very happy to recommend Mary Bird Perkins Cancer Center at TGMC.
Okay, welcome back. Again, we're meeting with Dr. Edgar Feinberg II, who is a cardiovascular surgeon here in Houma at Terrebonne General Medical Center. And doctor, we kind of had a great, real good discussion, but what I wanted to focus on is heart surgery now, and I know you touched upon it, but now apparently it can be minimally invasive. Why don't you explain that term? Since I can't say it, I certainly don't know what it means, but go ahead.
What you're referring to is a new trend in trying to do heart surgery without doing the major incision that I talked about earlier. Traditional heart surgery is done with an incision that divides the breastbone, going all the way from the top right here, all the way through the breastbone. And what we've been able to do with some new technology is to do incisions, little smaller incisions on the side of the breastbone, around the ribs, and access the heart and access some of the structures around the heart, some of the major blood vessels, and operate on them using cameras and video scopes in order to do heart surgery. And that's allowing patients to heal faster, to have less discomfort after surgery, less time in the intensive care unit, and more time out of the hospital feeling better.
Okay, and I know I'm going to have a tough one with this, but a carotid endarterectomy?
Carotid endarterectomy. Correct.
Okay, thank you.
Yeah.
Why don't you tell me a little bit, if you don't mind, of when and how, I guess, this procedure is performed?
Well, one of the more common causes of stroke in our aging population is blockage that occurs in the carotid arteries. You have 4 arteries that go to your brain, one on each side. I think we've already all heard of the carotid artery, and then there's 2 in the back that are smaller. And a blockage in any of these 4 arteries limits circulation to the brain. And when that happens, you can have a stroke. What we've been able to do over years is detect the earliest blockages that occur, almost always occur in the mid portion of the neck and the carotid, right around here on either side, right or left side. And we've developed an operation that can be done in about half an hour by making a small incision in front of that area, going down to the artery. We'll open the artery up. We actually clean the plaque out and close the artery back. And the patient usually goes home the next day. And this operation can prevent stroke in a large number of people who have those kinds of blockage.
Okay, very interesting. And I guess just as an aside, I mean, the tools, I say tools, but the instruments that you use, I guess, must be very precise. And I don't know, but they seem to be that they would be small enough for you to go in, make whatever incisions you need, but yet not cause any collateral damage.
Yeah, well, I mean, I think that's important. That's really why it takes so long to train to become a cardiovascular surgeon. And I do use a microscope, microscopic lenses, and to see things much more clearly. And everyone does that does this kind of surgery.
Right.
And those people working in the field and those of us that have developed these operations, we spend a lot of time focusing on the anatomy and understanding what's not just the easiest way to get to an artery, but the safest way to get to an artery and expose it so that we can do what we need to do and not cause, as you say, any collateral damage.
Okay, very good. And now, in terms of other aspects of Terrebonne General Medical Center, the cardiovascular surgery program, what other aspects of that program are there?
Well, it's a robust program that involves not just the surgery for these kind of ailments, but also we have tremendous technology for screening patients to evaluate them to see if they have these kinds of problems, and then other treatments that are non-surgical. And like I alluded to earlier, for everybody that goes to surgery for some kind of vascular problem, there are probably 90 people who have been treated non-surgically, and it's because of the other technologies and the other medications and therapies and the other things that are available to you here in Terrebonne Parish that allows us to do that.
Okay, obviously it's a lot better if you can catch things on the front end to where you don't, have to deal with some of the things on the back end. What are some of the wellness tips maybe that you have that our audience can benefit from?
Well, I think the most important thing is to not smoke. If you smoke, stop smoking. That's the most significant controllable thing that you can do if you want to avoid seeing me. Okay.
Right.
The other thing is obviously try to exercise at least 3 days a week, 30 to 45 minutes, 3 days a week, and you try to eat a healthy diet. There's lots of debate about what a healthy diet is, but I think all things in moderation is probably the greatest principle to maintain, and to maintain a healthy weight and a stable weight, and to see your family doctor and get these things screened. Everyone over the age of 35 should probably know what their cholesterol is, and they should probably know what it was in the past 18 months or so. And you should be doing things to keep that number in a healthy range. And there's lots of debate about what a healthy range is, but for the most part, a total cholesterol under 200 and the right balance of the good cholesterol and bad cholesterol, as well as triglycerides.
Very good, very informative. And if anybody has some questions or need more information, I think we might have some information there. I imagine that they can call that number.
You can contact www.tgmc.com, as well as my website, www.cvheal.com, and CIS's website as well.
Okay, very good. And what about a phone number to reach, I guess, your office or anything? Or is it the same number here? Or?
Well, we can be reached through the hospital, or
Okay.
my office is at 850-6222.
Thank you very much, Doctor. Thanks for coming. We appreciate the services that you perform, for this particular area. We're very glad to have you in your credentials here in Terrebonne General Medical Center. So we thank you for coming by.
Thanks for having me, Jimmy. I really appreciate the time.
Okay, very good. What we're going to do is we're going to take a break. When we come back, Stan Gravois will be up and take you home in sports.